It's so good to be here this afternoon, and it's really interesting to listen to those wonderful presenters. And it's an honour to have the opportunity to present some research that I've been undertaking in Western Australia, and it's from Western Australia that I come to you today. So the name of my research has been introduced as being the Applying the Partnership Approach to Care to Facilitate the Optimal Health and Wellbeing of Preschool-Aged Aboriginal Children. Oh, I'm having trouble moving my slides. Okay, so it is a qualitative study in the Goldfields region of Western Australia. And I failed to put in a map of Australia, but for those who can imagine the terrain, the country of Australia, Western Australia probably covers 1/3 of the land mass, and it's on the western side, as the name of the state would suggest. And as I move forward to present this information, I would like to acknowledge the Aboriginal people of the lands on which we meet today. This research has been informed predominantly by the Wangata people of the northern goldfields of Western Australia and the Noongar people of the southern goldfields of Western Australia. It is with respect for the knowledge, guidance and input that this project has received from elders, community leaders, caregivers and families that I present these findings to you today. To provide a bit of a background around this research and how I came about to be involved in the project, I think it's important to give a bit of a background around myself and my family. So I'm a mother of 8 children who range in age from 27 to 3 years. Of those 8 children, 5 are shared with me by their families, with their legal guardianship sitting with the Department of Communities Child Protection. I have 4 beautiful grandchildren. I spent all of my childhood in rural and remote Western Australia, much of it in Leonora in the Goldfields, where I currently am sitting. I live in Leonora, which allows the children who I raise with the Department of Child Protection to stay close to their family and to their country. So the decision to undertake this project has been shaped by a few factors. The repeated questioning from other, mostly health professionals, including executive managers, around how there was such a strong engagement with Aboriginal families in the areas which I worked. This resulted in me spending a lot of time reflecting on perhaps a somewhat unique position that I hold in this community and the importance of relationships in the work that we do in healthcare. I also spent a lot of time pondering on dialogue from other service providers and health professionals around working with Aboriginal families. The result of my thoughts and experiences drove the desire for me to better understand what authentic partnership was and what it looked like for both myself to benefit and to assist health professionals working with Aboriginal families. So the aim of this research is on the screen. So WACS Community Health, WA Community Health Service promotes working in partnership with Aboriginal families. So the aim of this research is to highlight the views of key stakeholders, those named on the slide, regarding the way that community health nurses adopt a partnership approach to care. In order to undertake this research, ethics approval was obtained from WA Country Health Service Research Ethics Committee and reciprocal approvals from West Australian Aboriginal Health Ethics Committee and Curtin University Human Research Ethics Committee. I just want to jump back to, as I go into the background, I want to jump back and reflect on a comment made by the previous speaker. The reason that I chose qualitative research methods in this project stems from the basis of a comment that was made. Oftentimes in healthcare, we have lots of data, but no insight or information. I thought that was a wonderful comment from the previous speaker, and it sums up the need in this case for me to undertake a qualitative research, and you'll see methodology as we move forward. So a bit of a background. So the partnership approach to care has been adopted in Australia and internationally as an approach that promotes the engagement and participation of families. partnership is one of the guiding principles to improve the health and wellbeing of Aboriginal people in the West Australian Aboriginal Health and Wellbeing Framework 2015 to 2030. It's a guiding document of ours. There is ongoing comparison between Aboriginal and non-Aboriginal people in Western Australia, utilising a Western lens which has a focus on values and belief which are not always held by Aboriginal people. This has resulted in much negative conversation around Aboriginal people. Despite the negativity and challenges, many Aboriginal people are achieving good health, well-being and success in both the Western and Aboriginal worlds in which they move. As this project highlights, there is much to learn from our Indigenous heritage which can inform our practice nationally and worldwide. Moving into methodology, an Aboriginal reference group representative of cultural, linguistic and geographic diversity of the area was compiled. The group was instrumental in the compiling of interview and focus group tools and all participant information sheets. Results were also shared with the group to ensure accuracy of interpretation and induction of themes. A contextualist approach was adopted to understand partnership within the specific context of community health nursing with Aboriginal families. The unique social, cultural, historical, environmental factors that influence the adoption of a partnership approach were considered. Reflexive journalism was undertaken to enhance the reliability and validity of the research by encouraging critical reflection on my own biases, assumptions, and to critique the research process. Feedback of the results was provided to the members of the Aboriginal reference group. This slide is rather busy, but it's a summary of results. There were 16 interviews undertaken and 4 focus groups with Aboriginal parents and caregivers. There are a total of 32 Aboriginal community leaders, parents and caregivers. So we have 4 main themes emerging from this rich data that was obtained from the participants. Under each theme, sub-themes have emerged. So out of this summary of results, we've compiled a shaping of a framework. So these themes have informed the creation of this framework to guide health professionals to effectively work in partnership with caregivers of Aboriginal preschool-aged children. The slide shows a diagrammatic representation of the themes in the framework. The overarching aim of working in partnerships is situated above the major theme of understanding culture and Aboriginality. There is a two-way arrow linking the two themes as they inform each other. The 3 other major themes are linked together and to the major theme of understanding of culture and Aboriginality by dual-ended arrows. The 3 major themes form the basis of practice, and their application culminates in effective working in partnership with Aboriginal families of preschool-aged children. And this is illustrated through arrows arching from the base themes to the overarching theme of working in partnership. The Aboriginal health professional is pivotal in the implementation of the partnership approach. Aboriginal health professionals bring with them cultural understandings that are almost impossible for a non-Aboriginal health professional to attain. Aboriginal health professionals most often have knowledge of families which spans a large geographical area, as well as ancestral understanding of historical events which affect relationships and behaviours of family groups today. The developing understanding with WA Country Health Service of value of the Aboriginal health professional is resulting in a shift in practice. For example, in the child health program space, the Enhanced Child Health program supports Aboriginal health workers' scope of practice being widened. Another program from WA Country Health Service is the Ear Health program, which has had for a number of years the strong voice of specialised Aboriginal health workers. WA Country Health Service have recently established several Aboriginal health practitioner positions in the regions. The Aboriginal Workforce Development Framework is currently being developed to support Aboriginal health workers in WA Country Health Service to further develop and maintain skills. Moving forward, there needs to be further education of non-Aboriginal health staff around the value of Aboriginal health professionals and promotion of the need to expand the scope and utilisation of Aboriginal health professionals such as Aboriginal health community workers. Ongoing workforce development is required for community health staff around effective communication, including listening skills, and the adoption of a strengths-based approach which highlights the caregiver as the expert in their world and the primary resource for the child and children. I want to move forward and draw a parallel between working in partnership, as we've been discussing, and cultural safety. As the slide demonstrates, the Australian Health Practitioner Regulation Agency has included cultural safety in the Code of Conduct and Code of Ethics for nursing and medical professionals. So the adoption of culturally safe practice in high-level documents, including health professional codes of practice and ethics, is an example of the acknowledgement of the importance of staff working within the client's context and perspective to ensure acknowledgement of their social determinants or situations. There was repeated acknowledgement by stakeholders involved in the Goldfields research that many staff expressed a genuine interest in parents and caregivers, their families and situations or social determinants of health. But other staff seemed to have a checklist approach and were purely focused on achieving what they were able to achieve during the consultation. Participants expressed the desire to be heard and their concerns acknowledged. So what does this all mean for the clinician? It's clear to the author that for many staff, the concept of culturally safe practice and partnership remains somewhat elusive and mysterious. Academics are seeking practical examples and resources to support the teaching of cultural safety. Culturally safe practice aligns nicely with authentic partnership. It encourages a reflection on one's own position and stereotypes and promotes a genuine interest in the perspectives of the client. The approach supports improved communication and mutual respect, where action and plans are formed through joint agreement, drawing on the strengths of the client. The role of the health professional is that of a health resource rather than the health expert. The following quote by a community leader came out of the research, and it encompasses the views expressed by some of the Aboriginal people and health staff alike. I think they, that is, community health nurses, go by textbooks more than anything else. It's not a relationship with a person. There's a textbook like, this is how I see you, and this is how it's written, and this is where you fall in, under that category. Another direct quote, this time from a parent, supports this sentiment. They just want you to go there, get their stuff done, send you on your way, really, as long as they get their needles and everything. There are requirements for each consultation, and there is no suggestion that these should be overlooked. However, through open discussion and genuine curiosity about the client's circumstances and views, there can be understanding and agreement around what the parent or caregiver needs and the staff requires. When staff hold a genuine interest in the client and a curiosity about their life, there is a shift away from stereotyping. The quote by an Aboriginal parent we're all not the same, we all grew up differently, offers poignant insight around the importance of authentic inquiry and interest in each individual client. This supports the definition of cultural safety, which is defined as being determined by Aboriginal individuals. The approach acknowledges the variability in culture of modern Aboriginal people. One child health nurse offered some sage advice when she summarised that a culturally safe approach is looking at what the issue or situation looks like from the Aboriginal client's perspective rather than ours. The adoption by staff of a genuine curiosity into the circumstances and perspectives of the client supports culturally safe partnerships. I have some publications related to this work. If there are participants interested in further reading, these are listed here. I have one more recent one which was only published last week, and that focuses on cultural safety. I would like to acknowledge Dr. Garth Kendall, Dr. Alsa Munns, and Principal Supervisor Dr. Georgia Halkett. For those who may wish to reach out and contact me, I do have an email address via Curtin University, and that is listed below. And these are the references that I've utilised throughout this presentation today.